Preferably, most people would like this one. It's more cartoon, it's more kid.
Yeah.
It screams kid.
It's a scream kid. I agree.
Up to 30 to 50% of us are non-adherent with our medical regimens on a daily basis. I was previously a transplant cardiac surgeon, and there were definitive problems within the space with patients being able to adhere to their medical regimens. And what we realized is, though I was seeing this as a problem in the transplant space, this is really a problem throughout the medical space, and it approaches all disease processes or all chronic disease processes. So we designed software and services to improve engagement and healthy medical behaviors. Up until this point, there have been solutions that have been sort of a one solution approach to an entire patient population. And as we know, the population that we deal with is diverse, and there are a variety of different tastes, needs, and skill sets. Patients don't want to think about things in a serious manner all the time. They don't want to think that everything is a life or death matter. We've devised a very diverse software interface for patients that consists of games, reminder education apps, and even animated iBooks. If we couldn't actually engage the patient population within their medical care, we were never going to be able to achieve the results that we wanted to. I was talking about all the different things that we could do with reminder apps and with educational materials and using IT sources to educate patients about their regimens, and there was this little voice behind us that then said, "Mom, nobody is going to do any of this if you don't make it fun." She really had the best idea out of the whole thing, and that until we made it fun, that we really weren't going to engage the patient population. We're not only monitoring adherence to appointments, labs, medications, and education, but we're now also monitoring those interactions with peripheral devices. And what I mean by that is blood pressure cuffs, scales, activity trackers, and other sort of devices that people can now use in their daily lives and even track on mobile devices. As these patients are interacting with their devices, we're actually monitoring their interactions. So we're actually monitoring when they engage with the devices, when they actually are clicking into their medical regimens, what else was going on sort of that they reported was going on in their lives at that time point, and trying to bring all this data into a data package where we can then optimize a solution for them. Patients want their medical regimens at their fingertips. They want to be able to have more control over those things now. They want that empowerment.